Gastroesophageal Reflux Disease, GERD, is a common digestive disorder that affects a significant portion of the population. It occurs when the stomach acid and contents flow back up into the esophagus, causing irritation and inflammation. The esophagus is a muscular tube that connects the mouth to the stomach. It has a ring-like muscle at the lower end called the lower esophageal sphincter, LES, which acts as a barrier to prevent the stomach contents from flowing back up into the esophagus. However, in some cases, the LES may not function properly, allowing the stomach acid and contents to reflux into the esophagus. GERD can cause a range of symptoms, including heartburn, regurgitation, chest pain, difficulty swallowing, and a sour taste in the mouth. These symptoms can be mild or severe and can occur intermittently or persistently. Several factors can contribute to the development of GERD, including obesity, pregnancy, smoking, certain medications, and a hiatal hernia. Additionally, certain foods and drinks, such as spicy or fatty foods, caffeine, and alcohol, can trigger or worsen GERD symptoms. If left untreated, GERD can lead to complications such as esophagitis, strictures, and Barrett's esophagus, which can increase the risk of developing esophageal cancer. Therefore, it is essential to seek medical attention if you experience persistent GERD symptoms. Diagnosis of GERD typically involves a physical exam, medical history, and various tests, such as an upper endoscopy, pH monitoring, and esophageal manometry. Treatment options for GERD include lifestyle modifications, such as weight loss, avoiding trigger foods, and elevating the head of the bed, as well as medications, such as antacids, proton pump inhibitors, and H2 blockers. In severe cases, surgery may be necessary to repair the LES or strengthen the lower esophageal sphincter. Gastroesophageal reflux disease, GERD, is a chronic digestive disorder that occurs when stomach acid or bile flows back into the esophagus, causing irritation and inflammation. GERD is a common condition that affects approximately 20% of the population in the United States. The primary cause of GERD is a weakened or dysfunctional lower esophageal sphincter, LES, a ring of muscle that separates the esophagus from the stomach. Normally, the LES opens to allow food and liquid to enter the stomach and then closes to prevent the contents of the stomach from flowing back into the esophagus. However, when the LES is weak or relaxes inappropriately, stomach acid and bile can reflux into the esophagus, causing damage to the lining of the esophagus and leading to GERD symptoms. Several factors can contribute to the weakening of the LES, including obesity. Excess weight can put pressure on the stomach and LES, causing them to weaken and allowing acid and bile to reflux into the esophagus. Hiatal hernia. A hiatal hernia occurs when a portion of the stomach protrudes through the diaphragm and into the chest cavity, which can weaken the LES and increase the risk of reflux. Pregnancy. Hormonal changes and increased pressure on the stomach during pregnancy can cause the LES to relax, leading to reflux. Smoking. Smoking can weaken the LES and increase the production of stomach acid, making reflux more likely. Certain foods and drinks, spicy or fatty foods, caffeine, alcohol, and carbonated beverages can all contribute to reflux by relaxing the LES or increasing stomach acid production. Other factors that can increase the risk of GERD include age. GERD is more common in older adults, a family history of GERD, and certain medical conditions, such as scleroderma and gastroparesis. In summary, GERD is caused by a weakened or dysfunctional LES, which allows stomach acid and bile to reflux into the esophagus and cause irritation and inflammation. Several factors, including obesity, hiatal hernia, pregnancy, smoking, and certain foods and drinks, can contribute to the weakening of the LES and increase the risk of reflux. 1. Oatmeal. Oatmeal is a great food for GERD sufferers because it is a whole grain that is low in fat and high in fiber. The fiber in oatmeal helps to absorb excess stomach acid and can also help to regulate bowel movements. Additionally, oatmeal is a complex carbohydrate that is slow to digest, which can help to keep you feeling full and satisfied for longer periods of time. 2. Ginger. Ginger is a natural anti-inflammatory that can help to reduce inflammation in the esophagus and stomach. It can also help to improve digestion and reduce nausea. Ginger can be consumed in a variety of ways, such as in tea or as a spice in cooking. 3. Leafy greens. Leafy greens, such as kale and spinach, are high in vitamins and minerals that can help to support overall digestive health. They are also low in fat and easy to digest, making them a great choice for those with GERD. 4. Lean protein. Lean protein sources, such as chicken, fish, and tofu, are easy to digest and can help to keep you feeling full and satisfied. They are also low in fat, which can help to reduce the risk of acid reflux. 5. Bananas. Bananas are a great source of fiber, which can help to regulate bowel movements and reduce the risk of constipation. They are also low in acid, which makes them a great choice for those with GERD. Additionally, bananas contain natural antacids that can help to reduce the symptoms of acid reflux. 1. Fried foods. Fried foods are high in fat and can cause the lower esophageal sphincter to relax, allowing stomach acid to flow back into the esophagus. This can lead to heartburn and other GERD symptoms. 2. Chocolate. Chocolate contains caffeine and theobromine, which can relax the esophageal sphincter and allow stomach acid to flow back into the esophagus. Additionally, chocolate is high in fat, which can also trigger GERD symptoms. 3. Citrus fruits. Citrus fruits, such as oranges and grapefruits, are highly acidic and can irritate the esophagus. This can lead to heartburn and other GERD symptoms. 4. Spicy foods. Spicy foods, such as chili peppers and hot sauce, can irritate the esophagus and cause heartburn and other GERD symptoms. Additionally, spicy foods can increase stomach acid production, which can exacerbate GERD symptoms. 5. Carbonated beverages. Carbonated beverages, such as soda and sparkling water, can cause the stomach to expand and put pressure on the esophageal sphincter. This can cause stomach acid to flow back into the esophagus and lead to GERD symptoms. Gastroesophageal Reflux Disease, GERD, is a common condition that occurs when stomach acid flows back into the esophagus, causing discomfort and damage to the lining of the esophagus. While some people may be more prone to developing GERD due to factors such as genetics or certain medical conditions, there are several lifestyle changes that can help prevent the onset of GERD. One of the most important steps in preventing GERD is maintaining a healthy weight. Excess weight can put pressure on the stomach, causing acid to flow back into the esophagus. Eating a healthy diet that is low in fat and high in fiber can also help prevent GERD. Avoiding trigger foods such as spicy or acidic foods, caffeine, and alcohol can also help reduce the risk of developing GERD. Another important factor in preventing GERD is avoiding smoking and secondhand smoke. Smoking can weaken the lower esophageal sphincter, which is the muscle that prevents stomach acid from flowing back into the esophagus. Additionally, smoking can increase the production of stomach acid, making GERD symptoms worse. Eating smaller, more frequent meals can also help prevent GERD. Large meals can put pressure on the stomach, causing acid to flow back into the esophagus. Eating slowly and chewing food thoroughly can also help prevent GERD by allowing the stomach to digest food more easily. Finally, it is important to avoid lying down or going to bed immediately after eating. This can cause stomach acid to flow back into the esophagus, causing discomfort and damage to the lining of the esophagus. Waiting at least 2 to 3 hours after eating before lying down can help prevent GERD. By making these lifestyle changes, individuals can greatly reduce their risk of developing GERD. While some people may still develop GERD despite these preventative measures, following these guidelines can help reduce the severity and frequency of symptoms. GERD, or Gastroesophageal Reflux Disease, is a condition in which the stomach acid flows back into the esophagus, causing discomfort and irritation. This can lead to symptoms like heartburn, chest pain, and difficulty swallowing. Fortunately, there are several ways to manage and even cure GERD. 1. Lifestyle changes. Making changes to your diet and lifestyle can help reduce the symptoms of GERD. Avoiding foods that trigger acid reflux, such as spicy or fatty foods, caffeine, and alcohol, can help. Eating smaller, more frequent meals and avoiding eating before bedtime can also reduce symptoms. Losing weight and quitting smoking can also help. 2. Medications. There are several medications available to treat GERD, including antacids, H2 blockers, and proton pump inhibitors, PPIs. Antacids can provide quick relief for mild symptoms, while H2 blockers and PPIs can reduce the amount of acid produced in the stomach over a longer period of time. 3. Surgery. In severe cases, surgery may be necessary to treat GERD. One common procedure is called a Nissen fundoplication, in which the upper part of the stomach is wrapped around the lower esophageal sphincter to strengthen it and prevent acid reflux. 4. Natural remedies. Some people find relief from GERD symptoms by using natural remedies, such as ginger, chamomile tea, or apple cider vinegar. However, it is important to talk to your doctor before trying any natural remedies, as they may interact with other medications or have side effects. 5. Alternative therapies. Some alternative therapies, such as acupuncture and hypnotherapy, may also be helpful in managing GERD symptoms. However, more research is needed to determine their effectiveness. In conclusion, there are several ways to manage and cure GERD, including lifestyle changes, medications, surgery, natural remedies, and alternative therapies. It is important to work with your doctor to determine the best treatment plan for your individual needs. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.